come all the way from Australia to participate in the Paris ECMO course. What brought you here?
It's multiple reasons. It was part of a travelling plan, and also we've recently introduced ECMO into our intensive care unit. So it was a very exciting place to come. Paris is an exciting place, and what I've realised since coming here is that the use of this technology has been much more extensive, and for that reason it's incredible to come and be able to share and learn from people who've been trialling it in different clinical settings, so that we don't have to repeat some of the earlier difficulties that they have. They're providing some good guidelines and suggestions of how to use it. So I'm tapping into the knowledge developed here and doing it in a very nice place.
You participated yesterday in the hands-on course at the surgery school. How did you find that course?
Well, very good and hands-on in that obviously as a clinician of some time now I haven't had that exposure to animal models and cadavers, and certainly trying that your hands-on doing those techniques in that setting has obviously been quite difficult to set up for them, so it's been wonderful to have that exposure and that experience to trial that.
And then afterwards you were lucky enough to get a visit of La Pitié.
Yes, no, that was wonderful. So for me as a clinician it was very good to be able to go to the unit, 2 different units, the medical unit as well as the cardiothoracic unit, and to see their use of ECMO as well as some of the other devices within that setting. And the added benefit is to today hearing some of those same clinicians that took us on the visit yesterday outlining some of the data that they've collected in that setting. So that's been very helpful.
So you were talking about cardiac sessions and intensive care sessions?
They did take us to the medical intensive care as well, and the gentleman who just spoke about using ECMO in people with severe or patients with severe sepsis where they have got cardiac complications. That's probably one of the first areas to be reporting this. So it's one of their first trials areas that they've now reported in the last 12 months. So it's great. He actually showed us one of the patients that was involved in it yesterday, and then he presented a series of the ones that they trialled. So that was very good.
Excellent. So it's been a good experience all round.
Yeah, it has been wonderful. Thank you.
Wonderful. Thanks.